Pigmented lesions of the oral mucosa are rare. These lesions may be of melanotic, vascular, or exogenous origin. Lesions of melanotic origin are categorized as single macules, multiple macules, and diffuse pigmented areas, which correspond to numerous diagnoses. Ethnic pigmentation is certainly the most common diffuse pigmented lesion. It is not a true lesion, but rather a physiological variation, most often seen in patients of color. These ethnic pigmentations may be associated with exogenous pigmentations, which produce a diffuse gingival pigmentation. The aim of pigmentation in the form of gingival tattoos is mainly aesthetic. They are linked to the application of dyes to the gingiva, which have been scarified to allow impregnation of the pigment. Chronic inflammatory lesions may be responsible for a pigmented discharge. This seen here in the context of lichen planus. The pigmented discharge may take on different colors. This may simply involve a slightly brownish coloration, as can be seen here on the upper lip, or a slate grey coloration of the cheek. The anatomical pathology tests demonstrate a pigmented discharge from the lamina propria. Smoker's melanosis. This involves a slightly diffuse pigmented area, secondary to tobacco use. It is a benign condition. Here the lesion is sited mainly on the upper lip. Pigmentations of the oral mucosa can arise from endocrine diseases, as can cutaneous pigmentations. Here, Addison disease has produced areas of slate grey coloration caused by the absence of inhibition of MSH and ACTH by endogenous corticosteroids. Some nevi may cause pigmentation of the oral mucosa. These nevi are rarely present on mucous membranes, contrary to what can be observed on the skin. This is a melanocytic nevus observed in a young child. The diagnosis was established by the anatomical pathology tests. In most cases, nevi need to be monitored annually. Diffuse pigmented areas are often linked to the use of medication. In most cases, this relates to long-term use of chloroquine. Pigmentations can be observed in the context of chemotherapy, as here in the case of treatment with capecitabine. It should not be forgotten that tetracyclines bind to developing mineralized tissues and that their use during teething is contraindicated, as this risks producing a blackish discoloration of the tooth. This can be observed on the inferior incisors in this patient. Lentigenes. These are individual pigmented macules. They are relatively common on the oral mucosa. They are characterized clinically by a homogeneous macule of millimetric dimensions, which has no tendency to increase in size. Anatomical pathology tests detect melanocytic hyperplasia associated with a pigmented discharge from the lamina propria. Melanomas of the oral mucosa are cause for concern. They are relatively rare. The majority of melanomas of the oral mucosa are secondary to a melanoma of the respiratory mucosa. So these are extensive forms. Mucosal melanomas are extremely serious, as the 5-year survival rate is currently less than 8%. Multiple macules associated with several lentigenes can be observed. It is referred to as lentigenosis, as seen here on the dorsal surface of the patient's tongue. Lorgia Hunziker syndrome is a specific syndrome characterized by multiple melanotic pigmentations in the form of melanotic plaques, cited here on the labial and gingival mucosa. Anatomical pathology tests demonstrate melanocytic hyperplasia in the basal layer. Addison disease can also manifest as multiple melanotic pigmentations. The diagnosis of Addison disease must be envisaged where there is slate grey coloration of the oral mucosa. Finally, exogenous pigmentations in the form of gingival tattoos may be observed. These may have an iatrogenic cause resulting from the diffusion of heavy metals following dental treatment. Very often these lesions are characterized by a brownish or greyish coloration close to a tooth. Tattoos may also be undertaken for aesthetic reasons. We have seen one such tattoo on the gingival mucosa, and this is a labial tattoo. Colorations of exogenous origin can be observed following colonization of the mucosa by chromogenic bacteria. This is a black, more or less hairy tongue. These lesions should not be mistaken for candidiasis. Treatment is based on brushing the tongue, combined with the use of keratolytic agents to various degrees. Vascularized lesions may give rise to pigmented macules of the oral mucosa. These may involve venous malformations, venous dilatations, ecchymoses with hemosiderin tissue deposits, or hypervascularized tumors on the right, for example, in the form of Kaposi syndrome.